Thank you for joining us at the Parenting at Mealtime and Playtime webinar. The Ohio chapter of the American Academy of Pediatrics operates this program with the financial support of the Ohio Department of Health. The Parenting at Mealtime and Playtime program, also known as PMP, has continued to evolve over the last several years to offer the best possible resources to you and the families you serve. Today we are excited to share more information on the programs in Ohio. Today you will hear from Dr. Sarah Adams, a pediatrician from Akron, Ohio, and the medical director for the Parenting at Mealtime and Playtime. Dr. Adams will be speaking about the importance of hunger and fullness cues. The Parenting at Mealtime and Playtime program is here to assist you in your discussions with families. We aim to provide tools that will make your interactions more meaningful in the limited time that you have with them and contribute to positive, helpful behavior change. In order to access our resources, we recommend you visit our Ohio AAP website. This is the easiest way to access the PMP materials. This is available for all public health professionals at no cost and no login is required. When you visit the website www.ohioaap.org/PMP resources and click the box that best suits your role. If you're a community health worker that works with a care coordination system, you will find our handouts within CCS as well. The speakers have no financial relationships to disclose and no off-label products will be discussed. Our mobile app has our resources that may be helpful for you and your clients. This mobile app is free for download in the App Store or on Google Play. When researching for the app, search Parenting at Meal and Playtime rather than PMP to be sure to find the correct mobile app.
Welcome. I am really excited to have this time to talk to you about a very important topic, which is hunger and fullness cues with our infants and toddlers. We're going to talk today about the importance of healthy eating behavior, responsive parenting, hunger cues, fullness cues, when are infants ready for solids, as well as tips for feeding to give our parents. The importance of a healthy feeding behavior has really been a discussion since the rise of childhood obesity and the risk of being overweight or obese that has gone into adulthood. There's been conclusive evidence that the first 1,000 days, which is from birth to 2 years, are really critical for childhood obesity prevention. It's important to provide messages and strategies to caregivers to improve dietary, weight, and overall healthy outcomes in children. Infant and toddler feeding guidelines on what and how to feed infants and toddlers within the guidelines of growing children and responsive parenting is very important. Responsive parenting, as it relates to feeding, soothing, sleep, and physical reactivity, is interrelated. Responsive parenting, as it relates to feeding, soothing, sleep, and physical activity, is interrelated. If a parent responds to hunger and fullness cues instead of using food as a soothing method, this will help the child sleep better, become more active when they're awake, and better self-regulate their appetite. In other words, the child is going to be better at listening to their body. So what is responsive feeding? Well, it's watching for baby's cues, it's responding warmly and promptly, feeding the right foods for their age and stage, it's stopping when the child is full, focusing on being affectionate, and nurturing at mealtimes. And if we're a responsive parent, this develops outcomes that are positive in infants and children. So we know that how we respond as parents and caregivers definitely resolves in a good outcome. So let me give you some examples. Responding to these fullness cues, such as if an infant or child starts and stops feeding often, spits out or ignores the bottle or breast, unlatches while breastfeeding, closes her mouth or turns her head away, fidgets or gets distracted easily, slows down or falls asleep, and the parent responds to these cues, we develop positive outcomes in children. They have healthy eating habits. They know when they're hungry and when they're full. They listen to their bodies. They develop stronger bonds with their caregivers, and they learn that mealtime can be fun. So, what are the key principles and steps to responsive feeding? The key steps and principles are to be pleasant, warm, and nurturing, and to have a pleasant and warm and nurturing feeding environment as well. The child should be seated comfortably, facing caregivers and others if they're having a family meal together, as well as if you're holding the baby to feed the baby. You should have clear and consistent communication. You should have routines with feeding and have a schedule. Offering a healthy development and appropriate food and also beverages are so important. But most importantly is responding to their hunger and their fullness cues. So how do we shape these food preferences? Well, remember those 1,000 days I mentioned? The first 2 years of life represents a very sensitive period we call the window of opportunity. Humans learn to eat healthy, nutritious diets, among other things, that helps protect against that risk of childhood obesity. So that's our window of opportunity. A key aspect of this sensitive period is to develop flavors that we like throughout life. So humans are born with the preference to like sweets and reject sour or bitter tastes, aka vegetables. So those first 1,000 days really represent a very important time for us to help them start to like that bitter, sour taste of vegetables. So infants and toddlers can actually learn to like healthy foods, to like bitter and sour tastes throughout those first 1,000 days through repeated exposures. It's very important to offer a variety of vegetables. Offering the same vegetable repeatedly has just shown to offer acceptance to that particular vegetable. So we want to provide a variety of a bunch of different vegetables at greater amounts instead of just giving them the same ones that they like. Also, expose them to different textures. And studies have also shown that infants need to be exposed to these fruits and vegetables many, many times. Maybe 6 to 35 times across different studies have shown to learn to like them. Context of feeding is also very important. Let me explain what that means. So, I've mentioned this before, that children are born basically to learn and understand to eat when they're hungry and stop when they're full. And so we need to listen to those cues. And as they develop, they become familiar. They associate and they observe. So let's go over those things. Familiarization. Allow infants and toddlers to become familiar with healthy foods so that they're accepted. Vegetables are key for their development of liking healthy foods and preferences. So becoming familiar with vegetables, becoming familiar with fruits, as they grow, they learn to like them because they're familiar with them. Association. It's important to provide a positive experience associated with healthy foods. This promotes acceptance of those healthy foods as well. So, responsive feeding that provides a developmentally appropriate and positive interaction between the caregiver and the child during feeding is really necessary for infants and toddlers to try and learn to like healthy foods and beverages without undue pressure. Observational. So, infants and children, they have a strong capacity to observe, process, and imitate what caregivers do, including what they eat. Young children are actively observing and learning from their surroundings, and it is very important that the whole family consume healthy meals and beverages, and that the infant is engaged with the family meals as soon as he or she is developmentally ready. Before they can talk, infants show signs of fullness with sounds and movements. They close their mouth, turn away from the breast or bottle, or even just you can see them relax their hands. Push food away, close his or her mouth when food is offered, turn the head away from food, use hand motions, or even make some sounds to let he or she know that they're full. They don't need to finish their bottle or all their food from the jar or plate. Toddlers can also turn away from food or shake their head to say no more or all done. Playing with or throwing food means mealtime is over. It's playtime. They can cover their mouth or face with their hands, cross their arms to show refusal of more food. Chewing can slow down or their attention can be somewhere else. They could spit out their food, his or her usually likes, lose interest in their food, lock their lips, squirm, or throwing or pushing your hands away. So even without language, you can see that there are definitely signs to show that they're full. So let's break down the hunger and fullness cues by age. Hunger cues include waking and tossing. They could suck on their fist, cry or fuss, and open their mouth while they're feeding to indicate that they want more. Fullness cues include sealing their lips together, turning their head away, decrease or stop sucking, spits out the nipple, or falls asleep when they're full. At 4 to 6 months, hunger cues include crying or fussing, smile, stare, or coo at the caregiver during feeds to indicate they want more, move their head or swipe food from the spoon toward their mouth. If they're full, they might decrease the rate of sucking or stop sucking altogether, spit out the nipple, turn their head away, or may become distracted and pay more attention to their surroundings. At 6 to 14 months, hunger cues could be they're reaching now for their spoon or their food, point to the food, get excited when food is present, express a desire for a specific food now using words or sounds. And when they're full, their eating will slow down, or they'll push the food away, clench their mouth shut, or shake their head and say, no more. 1 to 2 years, you'll start to see maybe combined phrases or gestures, such as, I want that, or pointing. Or maybe they'll just lead the parent or caregiver to the refrigerator and point to the desired food or drink that they want. And when they're full, they'll say, all done, get down, or play with their food, or throw the food around when they're full. So what messages can we give to caregivers to help them be responsive during feeding? As I said before, we want to provide a pleasant, warm, and nurturing feeding environment that takes into account the needs and development and stages that the child is in. We want to respond promptly and consistently to the child's hunger and fullness cues. It's very important to be a role model for healthy eating. Young children are more likely to try unfamiliar foods when they observe their caregivers eating them too, and eating them enthusiastically. Interact with your child during the meal. If they're trying new vegetables, eat them and show them what it looks like, smells like, and feels like instead of just taste. Provide positive experiences with healthy foods, and this will help them learn to accept it. Avoid distractions, including screens, during mealtime. This allows both parent and child to focus on their own hunger and fullness cues. Encourage, but do not force the child to eat. Follow the general tip: you provide, they decide when feeding your child. Try to provide nutritious options that are low in saturated or trans fat, low in cholesterol, salt, and added sugars, whenever this is possible, and try not to force your child to eat. Be mindful of amounts you provide. Remember, young children typically eat smaller, frequent meals. Ask your medical provider for advice if you feel you're having difficult times. Forcing a clean plate means difficult meals, resentment, power struggles around food. So pressuring babies or children to finish equals negative long-term effects, overeating, and really teaching them to not be able to recognize when they're full. So being positive, being responsive, as I mentioned, is going to lead to healthier outcomes. In a healthy feeding relationship, the infant initiates and guides feeding interactions, and the caregiver must respond early and appropriately to hunger and fullness cues, recognize the infant's and toddlers' developmental abilities and feeding skills, balance the infant's need for help with encouragement of self-feeding. So, we've been talking about feeding cues, but let's talk about, are they ready for solids? So do they sit up well? And what I mean by that is, do they have good support of their trunk? Another way to note is when they're on their belly, can they push all the way up on their forearms or lift their head and their chest up? Are they able to push food to the back of their throat with their tongue? Usually this starts between 4 and 5 months developmentally, and a baby is usually ready for sure between 5 and 6 months. Pediatricians typically start to discuss this at the 4-month well visit. The AAP recommends for breastfed babies that they actually start solids at 6 months of age. But now with new guidelines about starting foods as early as 4 months of age, to introduce different foods, tastes, varieties, and also to reduce allergies, it is best for them to talk to their pediatrician and really find out when the baby developmentally is ready for solids. The Ohio chapter of the AAP has wonderful handouts through our PMP program, and you could see on the right side of the slide, this is an example of one of our slides. And it just has a wealth of information for our caregivers about transitioning to solids. You will know that your baby is prepared for various textures of supplemental foods when they can put their hands to their mouth and bring toys to their mouth and explore different ways of mouthing objects. The ability to show a desire for food by opening their mouth and leaning forward, and then show that they actually are full by leaning back and turning away. When you can see that they can sit up with or without support, and grab and hold objects, and purposefully guide objects to their mouth, like I mentioned, then these can be guidelines that they're actually ready to eat. Now, some false cues can be things like watching others eat, waking at night, slow weight gain, lip smacking, or not falling asleep when they're eating. Those can be false cues. Continue breastfeeding and/or iron-fortified formulas, and offer first bites between breastfeeding or bottles. Babies begin joining families for meals as soon as they can. In the beginning, it's more about exploring foods. Don't worry if the baby isn't eating too much. use small amounts of soft foods to begin with, and let the baby feed him or herself how much and what they want and how quickly, based on their developmental stage and age. Starting solids too early can cause potential harms such as aspiration, which means that the food can get into their lungs because developmentally they're not able to swallow appropriately. It also can lack nutrients. They may nurse less or drink less of their formula, and they may not be getting the right amount of balance of nutrition. And it also increases the risk of obesity. But delaying solids also has risks as well. It decreases growth because of inadequate energy intake, iron deficiency as well, delayed oral motor function, and even an aversion to food. And then now with a new topic of development of allergies, as we mentioned that introducing some foods may be necessary to reduce the likelihood of allergies, which is a subject that is new and developing. Another word for solid foods is complementary foods, sometimes known as weaning foods. So solid foods and liquids other than human milk or infant formula is given to infants to prepare them for that transition from a liquid diet to a modified adult diet as they grow. By 1 year of age, most healthy infants obtain approximately a half of their energy from complementary foods. By 6 months, complementary foods become necessary to support their growth and also their fullness. By 6 months of age, also, human milk ingested exclusively by breastfed babies generally isn't enough to provide enough energy, protein, iron, zinc, and soluble fats. So what should they be eating? Single food ingredients first. The AAP Committee on Nutrition recommends infant cereals, pureed meats be offered first because of iron and zinc. Strained fruits or vegetables are also important. At least one feeding per day should include food rich in vitamin C to promote iron absorption. Fat and cholesterol intake are not restricted in infants, but no added sugars or salts, and no trans fats or saturated fats. So what I want to mention is that you start with one food first, and then you increase every 3 to 5 days, making sure that the child is tolerant. And what I mean by that is that you're watching for vomiting, diarrhea, rash. And so starting with a cereal, for example, that is iron fortified, and then going from there. Repeated exposure and variety is the key. By 8 to 12 months of age, caregivers should be encouraged to offer fruits, vegetables at least once a day. Offer a variety of fruits and vegetables. Offer fruits and vegetables that are initially refused at other meals. Variety is the key. Evidence that vegetables should be offered more or less frequently than fruits is lacking. Acceptability of new foods increases with repeated exposure. Up to 15 exposures may be necessary before a new food is liked. Breastfeeding may facilitate the acceptance of solid foods as a result of the variety of flavors transmitted through human milk. By 8 to 12 months of age, infants begin to refine the skills necessary to eat finger foods independently. These skills include ability to sit independently, eye-hand coordination needed to grasp, manipulate and release foods. They can start chewing even if they don't have teeth, and their ability to swallow. By the time the infant is 12 months of age, the hand grasp matures to a fine pincer grasp, which is the index finger and the thumb. and they improve the ability to eat finger foods. Finely chopped soft foods, such as small pieces of soft fruits, vegetables, cheese, well-cooked meats, cooked pasta, foods that dissolve easily, baby crackers, dry cereal, can be offered as finger foods. Foods that are choking hazard should be avoided. These foods include hot dogs, nuts, particularly peanuts, grapes, raisins, raw carrots, popcorn, and raw candies as examples. By 9 to 12 months of age, most infants are able to feed themselves and drink from a standard cup using 2 hands, and even eat foods prepared for the rest of the family with minor adaptations. So I just want to reiterate that kids who are fed healthy foods grow up loving healthy foods. And remember that window of opportunity and how important it is in those first 1,000 days to shape them and introduce them to as many healthy foods as possible so that they can grow up and enjoy and become familiar and observe and enjoy healthy foods. Responsive parenting is so important. Learning to identify their hunger cues, their fullness cues, knowing when to eat and what to eat, remembering that you provide, they decide, all achieves healthy outcomes. I want to thank you so much for the opportunity to talk about something I am so passionate about. We want to build healthy, happy children, and we want parents to be happy about their experience around teaching their children to eat healthy and be healthy. We all know that when our children are eating well, we feel good, and that also turns around and makes them feel good. So I'd like to take this time to go over some cases about frequently asked questions and the answers to those questions. Case number 1. Mom is concerned because her 2-month-old newborn is falling asleep on the breast. So the first thing I would like to know is how many minutes is she nursing on each side or one side, and how often? So Mom says that she is nursing 30 minutes on one side and is nursing every 2 hours. During breastfeeding, she can hear the baby swallow and even see some milk come out of the corner of her mouth. She said the baby seems very satisfied after she eats, sleeps very well, and she was recently seen by a home visitor who brought the scale and said that the baby was back up to her birth weight and gaining weight well. So we can very confidently tell this mother with reassurance that this is a fullness cue. The baby is gaining weight well, nursing appropriately, time, and is satisfied. She can hear the baby swallowing. She can see the milk. And so this is a fullness cue, and we can reassure the mom. Case number 2. You're doing a home assessment, and the mother has concerns that her 2-month-old baby is not nursing as long as she used to. She'll only nurse for 5 minutes at a time and then pulls off and becomes playful and happy. She is nursing every 3 hours, sleeping through the night, and was just at the pediatrician's office and is gaining weight well. Again, reassurance. This is a fullness cue. What are the key points? She's stopping when she's full. She's happy and playful. There's good timing between the feeding. She's sleeping well, and she's gaining weight. Case number 3. 6-month-old is sitting up well and has started to eat infant cereal with a spoon. He is doing good swallowing and really likes the cereal. When can you try the next food, and do you introduce it alone? The important thing to remember is to introduce one new food at a time. Wait 3 to 5 days before trying another food. Watch for any signs of allergy or intolerance. Remember, those are vomiting, diarrhea, or rash. It's okay to add new foods to other foods that you've tried and the baby likes. So for example, this little baby has tried cereal, so you could try sweet potatoes, for example, along with the cereal. Remember to try small bites, and don't be discouraged if they don't take too much right off the bat. This next case was actually a real case with my family's. Case number 4. Parents are concerned about their 18-month-old behavior. When he eats, he throws his food on the floor. I asked, when does this happen during the meal? They said he feeds himself, and it usually happens after he's been eating for a while. What is his environment? They eat together. They eat the same meal, which is really good, and they face each other. Remember, we want a warm, nurturing environment. And I did find out that the dog sits under the high chair. So I gave them reassurance. I said this is a fullness cue and not a behavior problem. But I did recommend that they probably need to remove the dog from the environment because he probably likes feeding the dog as well. Case number 5. Grandma gets irritated when her 2.5-year-old grandson makes faces and wastes the green beans she puts on his plate. Picky eating in toddlers is so common. Acceptance to foods can be off and on. One day they might like green beans, the next day they might not. Sometimes it takes multiple exposures, and sometimes you have to realize that one day they may like foods, and again, like I said, another day they may not. It's also important to know that toddlers sometimes have varying appetites. One day they can eat really well, another day they might not eat very much at all, or they might snack and graze. The important thing to remember and to tell our caregivers is that it is important that what we provide is healthy. Remember, you provide, they decide. Portions do not need to be large. Be mindful of the amount. Sometimes when they look at a plate and there's a lot on their plate, it can be very discouraging. Responsive feeding as a role model and association, remember, is so important. Remind Grandma that she has to be patient. Be a role model. Does she like green beans? Again, that you provide, they decide motto can be said over and over again. It can be so frustrating. And I know because toddlers, they're like teenagers. You can't reason with them, but we have to work with them still. And it's a joy. It can be fun. Mealtime can be really great. We just have to be patient. We have to be role models, and we have to be nurturing and consistent and communicate appropriately. Case 6. Dad is frustrated because his 4-year-old child plays with his food halfway through dinner. This is a fullness cue. Remember to encourage and do not force. Smaller portions like I mentioned. Remember the My Plate? Praise them for trying new things, staying at the family meal. Interact with the child during the meal and provide a positive experience. And as I said, toddler appetites, they come and go. Thank you again for joining me during this webinar. As I mentioned, if you provide and they decide, we will all be happy and healthy during meals. Responding to hunger cues, responding to fullness cues will build healthy behaviors in children. Remember the responsive parenting, giving our caregivers their messages will help and go a long way. Thank you again.
We sincerely appreciate you spending your time with the Ohio AAP to learn more about these important topics impacting children's nutrition and play. You can access the Parenting at Mealtime and Playtime resources on our Ohio AAP website. Thank you to our presenters for all they do for the Parenting at Mealtime and Playtime program and for Ohio's children. If you have any questions for Ohio AAP, please don't hesitate to call us at 614-846-6258. A big thank you to you for your ongoing efforts to assist Ohio's families.